What if I told you that while you work two jobs to pay your bills, someone else is getting housing, food, and health care without working a single day, and it's coming straight from your paycheck? In the United States, refugee and asylum programs are often discussed in abstract humanitarian terms. But when we strip away the political language and focus on the hard data, a far more complicated and expensive picture emerges. The U.S. spends billions each year to resettle and support people who enter the country under refugee or asylum status. The cost? It's not just in taxes. It's in housing access, healthcare strain, school overcrowding, and social service saturation. And while the American middle class keeps shrinking, the support given to new arrivals continues to grow. Let's start with what the federal government pays. Under the Refugee Resettlement Program, each refugee is eligible for a one-time payment for resettlement assistance. This payment, as of recent years, is just over $2,000 per person. But that's only the beginning. Once a refugee is in the system, they are eligible for temporary assistance for needy families, TANF, Medicaid, the Supplemental Nutrition Assistance Program, SNAP, and public housing benefits. These are not short-term handouts. Many recipients stay on these programs for years, sometimes decades. In fact, government studies have shown that even 5 years after arrival, a significant portion of refugees remain dependent on public assistance. What most Americans don't realize is how much this costs cumulatively. According to a Department of Health and Human Services report, the average refugee costs taxpayers over $130,000 over their first 20 years in the country. Multiply that by the number of refugees resettled each year, tens of thousands, and the numbers become staggering. Over a decade, we're talking tens of billions in taxpayer funds. One of the least discussed areas of spending is housing. In cities across the country, especially in places like Minneapolis, Buffalo, and San Diego, refugees are prioritized for public housing ahead of low-income American citizens. Why? Because federal guidelines classify them as high-need populations. That means a refugee family arriving yesterday can be placed in a subsidized apartment before an American family that's been on a waiting list for years. This isn't speculation. It's documented in multiple reports from state housing authorities. Healthcare is another massive cost. Refugees are immediately eligible for Medicaid upon arrival. That's full medical coverage funded by federal and state taxes. Unlike many Americans who pay thousands in insurance premiums, deductibles, and co-pays, newly arrived refugees can access emergency rooms, specialist care, surgeries, and prescription drugs with no out-of-pocket costs, and there's no work requirement to qualify. In some states like California and New York, the coverage is even more extensive than what many American workers receive. Education also absorbs a significant share of the cost. Public schools are required to provide services for refugee children, including language instruction, transportation, and often meal programs. In some districts, the cost per refugee child can be double that of a native-born student due to the need for specialized staff and resources. Teachers report classrooms where the majority of students are non-English speaking, requiring entire structural adjustments to curriculum and pacing. Local taxpayers foot much of this bill. Here's something that rarely makes headlines. Most refugees are not required to show any proof of work history, income, or even identification documents before accessing benefits. While most Americans must jump through layers of verification to get any form of welfare, the refugee process is fast-tracked, sometimes within days of arrival, and once benefits begin, there's little oversight or auditing. Investigations in several states have uncovered fraud cases involving refugees receiving duplicate benefits or working off the books while still collecting government aid. This system creates a dynamic that many Americans find deeply unfair. You work, pay taxes, buy expensive insurance, and fight to keep up with inflation, while someone else who just arrived in the country gets almost everything for free. And asking questions about this isn't just discouraged. It's often labeled as politically incorrect, but the financial story is only half of it. There's also the deeper question of sustainability. With border crossings at record highs and the Biden administration significantly increasing refugee caps, aiming for over 125,000 per year, The cost is accelerating. States are overwhelmed. Local agencies report backlogs, resource shortages, and growing tension among communities competing for the same social safety nets. And as more refugees are granted permanent residency, the long-term obligations increase even further. We also have to look at how these policies affect working-class Americans, especially those in cities with already strained infrastructures. In many cases, local governments reallocate funding from police, schools, and maintenance services to cover new housing and welfare programs for incoming refugee populations. That means potholes don't get fixed. Police departments are understaffed. Public schools go without basic supplies. And all of this is happening while local property taxes and sales taxes quietly climb. The scale of this issue becomes clearer when you look at federal grant programs like ORR, the Office of Refugee Resettlement. This department alone manages billions of dollars in annual funding, distributed to states and NGOs to support refugee placement and integration. But these funds are not always used transparently. Audits have found millions in misallocated or unaccounted for spending, often funneled through loosely regulated contractors and nonprofits that operate with minimal oversight. Meanwhile, working-class American families trying to apply for food stamps or housing vouchers often face months of delay, denied applications, or restrictive eligibility rules. That disparity between what's promised to refugees and what's delivered to citizens fuels resentment, and it's not hard to understand why. What's most alarming is that despite growing evidence of inefficiencies, fraud, and unsustainable costs, there's very little serious political discussion about reforming the system. Both parties tread carefully around the issue, fearing backlash or accusations of xenophobia. But ignoring these problems doesn't make them go away. It only makes them worse. In the next part, we'll break down specific case studies from key states showing exactly how much is being spent and who is benefiting. You'll see how taxpayer dollars are being funneled into programs that often exclude the very people paying for them. And we'll look at how a growing number of refugees are navigating the system in ways that allow them to remain unemployed for years while still receiving full benefits. Let's go deeper into where the money actually goes. State-level budgets reveal even more staggering numbers. In California, for instance, over $1 billion is allocated annually just for refugee-related services. This includes everything from rent assistance to mental health counseling, job training, and legal aid. The majority of this funding doesn't go to public institutions, but to third-party nonprofits and contractors. These organizations are often politically connected, loosely regulated, and rarely audited. One example is a major NGO in Texas that receives tens of millions in federal grants annually to provide housing and casework for newly arrived refugees. Internal reviews showed that nearly 30% of their spending went to administrative costs, including six-figure executive salaries, overseas travel, and consulting contracts. Meanwhile, the actual families being helped often received limited assistance, a few weeks of rent, grocery store gift cards, and vague promises of job placement that rarely materialize. Another overlooked issue is how refugee placement decisions are made. Local communities have virtually no say in how many refugees are sent to their towns or cities. These decisions are negotiated between the federal government and resettlement agencies, often behind closed doors. City councils and mayors frequently find out only after the fact, when buses arrive and social service departments are overwhelmed. This has caused major tensions in cities like Erie, Pennsylvania, and Fargo, North Dakota, places that were not prepared for the demographic, cultural, and financial pressures that followed. A report from the Center for Immigration Studies found that in cities with high refugee resettlement rates, public schools saw ESL, English as a second language, enrollment surge by over 200% in under a decade. This required entire new departments, teacher training, and resources that were not previously budgeted. At the same time, American-born students, especially from low-income families, experienced a sharp drop in academic support services and class performance due to reallocation of funds and attention. And what about employment? Contrary to popular belief, many refugees are not working within months of arrival. In fact, a recent study found that only about half of working-age refugees were employed within their first 5 years in the U.S. That number drops even further for women, especially those with children. Why? Because the social safety net removes much of the incentive to work. When rent is covered, healthcare is free, food is provided, and additional cash assistance is given, the urgency to find a job diminishes, especially when those jobs pay less than the combined value of the benefits package. One woman in Ohio who had been in the U.S. under refugee status for over 8 years openly admitted in an interview that she had never held a job and didn't plan to. Her explanation? The system works better for her this way. Her family of 6 receives housing assistance, SNAP, Medicaid, and monthly cash assistance, totaling over $40,000 a year, tax-free. Compare that to a working-class American family of 4, earning minimum wage or even double that, who pays rent, insurance, and taxes on top. This is not an isolated case. In states like Minnesota, entire apartment complexes are essentially refugee housing zones, paid for by public subsidies, with little evidence of employment or self-sufficiency. Local law enforcement and school districts often struggle to communicate due to language barriers and cultural disconnects, further complicating integration efforts. The issue isn't compassion. Americans are among the most generous people in the world. The issue is imbalance and transparency. Most taxpayers have no idea how many billions are spent annually on programs that are not helping them, their children, or their neighbors. The average person working a full-time job, paying into Social Security and Medicare, and barely affording rent is subsidizing a system that can provide more to someone who just arrived in the country than to someone who's lived here their entire life. The problem grows when you realize how difficult it is to remove someone from these programs once they're on them. There are no mandatory work requirements for most refugee benefits. There's no automatic time limit. Even citizenship is not a condition for continued aid. Many programs extend support for years regardless of legal status updates. And since the bureaucracy is so tangled, very few recipients are ever reviewed for eligibility past their initial application. There are also ripple effects on wages and job availability. Refugees who do enter the labor market often work in low-wage industries, sometimes under the table, driving down local wages and increasing job competition in areas where employment was already scarce. Employers benefit from cheaper labor, but local communities absorb the cost in public services, education, and social cohesion. Even more alarming is that the total refugee budget does not include indirect costs, like the impact on emergency rooms, law enforcement, or public transit systems. Those numbers are often absorbed into general municipal budgets, making the full cost invisible to most Americans. That's not just inefficient, it's deceptive. There is a growing conversation happening in small towns and suburbs, not just in the big coastal cities, about the long-term impact of these policies. People are asking, why is it so hard for a veteran to get housing, but so easy for a newly arrived non-citizen? Why do working families get penalized for making too much to qualify for food assistance, but others get full benefits with no employment record at all? And perhaps the hardest question of all, how long can this continue? These aren't questions of ideology. They're questions of math, fairness, and sustainability. The numbers don't lie, and they're only getting bigger. So here's the question we all need to be asking ourselves. If the system works better for those who don't work at all than it does for those who do, what kind of future are we building? If you've made it this far, don't forget to subscribe for more deep dives like this, and let us know in the comments. What do you think we should do about it?